Welcome to the deep dive. Today, we're tackling a really crucial and honestly incredibly sensitive journey. We're going to be exploring a guide for families who are navigating one of the most difficult phases of life,
Yeah.
the advanced stages of dementia, specifically when a loved one is in a long-term care home.
And our mission today really is to illuminate this huge shift in medical thinking that has to happen as the disease progresses.
A shift in philosophy almost.
Exactly. It's a transition away from, aggressively trying to fix everything and moving entirely toward a new core principle,
Could just
ensuring comfort, dignity, and peace. It's about giving you, the listener, the facts you need to make truly compassionate, informed decisions.
Before we get into that shift, let's just quickly set the scene. When we say dementia, we're not talking about one single illness.
No, not at all. It's a group of brain diseases. They all progressively damage memory, thinking, and, all the critical functions of daily life.
And that damage affects everything.
Everything. How a person speaks, how they behave, their ability to just care for themselves.
So the different types, they start out differently. Alzheimer's, for instance, that's one most people know. It hits recent memory first.
Right. But then you have something like vascular dementia, which can be caused by strokes. That might show up initially as a problem with, say, decision-making more than memory.
And Lewy body dementia. That one's known for those fluctuating changes in thinking, and it can come with movement issues, sort of like Parkinson's.
Exactly. And then there's frontotemporal dementia, FTD, it's a tough one. It often attacks personality and behavior first, long before memory really goes.
But even though they start differently, as the disease progresses, they all sort of end up in a similar place.
They do. In the late stages, the physical and cognitive collapse, it tends to converge. And that's when you need that single unified focus on comfort, no matter how it started.
Okay, so let's talk about what the guide we're looking at calls the hard truth. It's tough to hear, but it's the foundation for everything else we're going to discuss.
It is. The hard truth is that dementia is ultimately fatal.
No cure.
There is no cure. And the treatments we have, they can manage symptoms for a while, but they cannot stop the underlying disease from destroying brain cells.
And accepting that it's a terminal illness, that's the key.
It's absolutely critical because it shifts the goalposts entirely. You stop looking for a miracle and you start focusing all your energy on maximizing that person's comfort and dignity for the time they have left.
So let's walk through that trajectory. Families need a roadmap, even if it's a painful one. So the early stage, what does that look like?
In the early stage, the signs are, pretty subtle. Trouble remembering what happened yesterday, losing things, repeating the same question over and over.
Maybe a small change in judgment you can't quite put your finger on.
Exactly. And when someone's diagnosed in that early stage, the life expectancy is typically somewhere between, say, 3 and 7 years. They're still functioning, but they need more and more support.
Okay, then comes the middle stage. And this is often where things hit a crisis point for families, isn't it?
It really is. This is when care needs often become more than a family can handle at home. Independence just fades away.
They need help with the basics.
Daily, hands-on help. Getting dressed, bathing, eating. Confusion is a big one. Wandering can become an issue. Sleep patterns get all turned around.
And this is when the move to a care home often happens.
Yes. And it's important to know, statistically, even at this middle stage, the chance of dying within 1 year is already pretty significant. It's somewhere between 15 and 20%.
Which brings us to the late stage, advanced dementia. This is where the physical decline really speeds up.
It does. It's not just cognitive anymore. The body itself begins to shut down. The person might lose the ability to walk or to speak clearly.
Swallowing becomes a
A
problem.
major problem. And because they're immobile, they're so frail, you see frequent infections. Pneumonia is very common.
The prognosis here, it's quite stark. What are the statistics the guide gives?
They're sobering, but families need to know this for planning. For someone in the late advanced stage, the chance of dying within 6 months is 50%.
Wow, 50%.
And within 1 year, that jumps to between 70 and 80%. So when a doctor shares that data, it's a signal.
A signal that the focus have to change.
Immediately. It has to shift to comfort care. Now.
For a family member watching this day to day, the changes can be just heart-wrenching. What should they be prepared to see?
They'll see profound physical changes. Their loved one will start sleeping almost constantly, maybe just waking up for a few minutes.
And eating.
Eating becomes a real challenge, which leads to weight loss, more frailty. Conversations they dwindle, maybe to a few words or nothing at all. The body's just struggling to keep going.
The guide mentions two common ways people pass away in this stage. It's either a sudden illness or a slow decline.
Right. A sudden illness is often because the body is just too weak to fight something off. The most common is what's called aspiration pneumonia.
Where food or liquid goes down the wrong way.
Exactly, into the lungs. But it could also be a major infection, like sepsis or a stroke or a heart problem. It's a rapid decline over just hours or days.
And the slow decline. That sounds almost harder to watch.
It can be. It's a gradual fading. The person just eats a little less each day, sleeps a little more, they get weaker and weaker. Eventually, you'll see their breathing patterns change.
And recognizing that this is the disease, not a failure of care, is key.
That is absolutely central. Understanding this as part of the natural process is so important for a family's emotional preparedness.
Okay, let's really unpack this shift in medical care now. Because I think this is where families feel the most conflict. We're moving from trying to cure to providing pure comfort and dignity.
And the clearest example of this, the most important one, is something called deprescribing.
Deprescribing, so stopping medicines.
Deliberately. Systematically reducing or stopping medicines that are either no longer helping or worse are actively causing side effects that make life less comfortable.
I can see how that would feel like giving up, though. You know, Dad's been on this heart pill for 20 years, and now you want to stop it.
It feels like neglect. That anxiety is completely understandable. But the key is to reframe the goal. The goal is no longer longevity. The goal is comfort.
Right.
And the benefits of stopping pills are huge. Fewer side effects, less confusion, fewer pills to swallow, which can be really difficult. It just leads to calmer, better days.
So what kind of medicines are we talking about?
Well, the list makes a lot of sense once you adopt that comfort-first mindset. Cholesterol pills, like statins, are a big one.
Why those?
Because their benefit is long-term prevention. They take years to prevent a heart attack or stroke. In someone with months to live, they're just a burden. Same with some diabetes meds that risk causing dangerously low blood sugar.
What about blood pressure medicines? Those seem vital.
They do, but in a very frail person, lowering their blood pressure too much can cause dizziness when they stand up.
Which leads to falls.
Which leads to falls and broken bones, a catastrophe. If the pill increases the risk of an injury without adding any comfort, it has to go.
And what about the actual dementia medications, the ones designed to treat Alzheimer's?
Those are often stopped, too. By the late stage, the brain damage is so extensive that the medicines just don't offer a measurable benefit anymore. But they can still cause side effects, like nausea. So you're getting all the burden with none of the benefit.
The guide had a really specific example about osteoporosis medicine that I thought was perfect.
It is a perfect example. It takes years for those drugs to strengthen bones enough to prevent a fracture. So giving it to someone with months left, especially if it causes side effects, it's just adding to their discomfort for no reason.
And this thinking extends beyond pills.
Right.
To what the guide calls fewer tests, fewer referrals.
Yes. You avoid things that cause stress and agitation, routine blood work, for instance. Or worse, a CT scan that means a stressful ambulance trip to a hospital.
Because the test result probably isn't going to change anything.
Exactly. You have to ask, will this test change the plan? If the plan is comfort, the answer is almost always no. You just end up causing a huge amount of fear and anxiety for the patient for no good reason.
So the care team's focus becomes singular.
Treat pain, prevent suffering, keep the person calm and in their familiar space, avoid the hospital.
Okay, this brings us to what might be the hardest topic, but where the facts are the clearest. Resuscitation. CPR.
This is so important because our instinct is to do everything, but the evidence is overwhelmingly clear.
And what is that evidence?
CPR in a person with advanced dementia does not work. It is ineffective and it is harmful.
Let's hear the stats.
Less than 2%. 2 of people with advanced dementia who get CPR survive long enough to even leave the hospital. It's a staggeringly low number.
And for that tiny fraction that do survive, what's their condition like?
Almost none of them return to their previous state, and the procedure itself is violent. It breaks ribs, it can cause brain injury from lack of oxygen, it inflicts terrible suffering in someone's last moments for virtually no chance of a meaningful recovery.
So hearing that, it reframes the choice of a Do Not Resuscitate order, the DNR. It's not about giving up.
Not at all. It's an active choice for something. It's a choice for comfort, for dignity, for a peaceful passing. It's choosing to prevent aggressive, painful, futile trauma at the very end of life.
It's respecting the life they lived by protecting how it ends.
That's beautifully put. That's exactly it.
So what does all this mean for you, the family member, who's in the middle of this, the guide really stresses that connection doesn't just disappear.
It doesn't. Even when your loved one can't remember your name or your relationship, they feel you. They feel the comfort of your voice, the warmth of your touch, the simple grounding presence of someone who loves them.
That connection is still there.
It's sacred. It's vital, right to the very end. Your continued involvement, even when it feels one-sided, is so important to their well-being. Well, your familiar presence can reduce their agitation. It brings comfort. It keeps their world from feeling so chaotic. And most importantly, you are their voice. You know their history, their values. You are the one who guides those critical decisions about deprescribing and the DNR when they can't speak for themselves. You become their advocate for dignity.
We've covered some really profound ground. Let's just quickly recap the key takeaways for anyone listening. First, dementia is a terminal illness. It has a predictable, though painful, trajectory.
Yes, and the late stages involve a serious physical decline. They'll eat less, sleep more, become weaker. That's the natural course of the disease.
And the medical response has to pivot. It has to become about comfort.
And that means deprescribing, stopping medications is normal, compassionate, evidence-based care. And CPR, the data is clear. It does not work in this context and only causes suffering.
Okay, so a final thought to leave you with. If the entire emphasis in advanced dementia care shifts to comfort, dignity, and a peaceful end, how does understanding the medical necessity of stopping things, stopping pills, stopping tests, how does that free you, the family member, to let go of the anxiety of doing more and instead focus entirely on the singular, irreplaceable power of your loving presence in those final moments? That redefinition of care, that might just be the deepest comfort of all.